So we are starting with the last part, the last session goal, and that is rectum and anal canal. Word rectum means straight. Rectus abdominis. Okay, rectus femoris. The meaning of the rectum, in case it is straight, because it is straight in lower animals. Rectum in human beings is not straight, because human beings are straight, upright position. Therefore, we cannot afford to have a straight rectum. Otherwise, the frequency of going to the toilet will be every 1 hour, 2 hours, 3 hours. We cannot. God also knows that you have sessions from 8 to 12. Okay? So therefore, rectum is not straight, and rather it has two curvatures. To the right side, one to the left, 3 curvatures. When you look from the front, when you look from the side, it has 2 curvatures. One along the sacrum. This is sacrum. So this is concave, and then it becomes convex. So this is 1 and this is 2. So 2 anterior-posterior and 3 lateral curvatures. And the reason rectum has this in human beings, because in human beings rectum is not straight, because human beings are in a straight upright position. Animals का ये ऐसा straight रहता है, and that is why whenever they want to pass stool, they make their rear portion down. But those animals who eat non-vegetarian food, they have to strain. When those eat vegetarian food, even if the rectum is straight and horizontal, the advantage of fiber is the stool, they can still pass. So horse, cow, elephant, they in a standing position, they can still pass. They don't have to make their rear portion down. Okay? Rectum is 5-inch long. 5-inch long. It starts from S3 vertebra, S3, S4, S5. So that is the posterior relation of the rectum, S3, S4, S5. And it ends 2 to 3 centimeters in front of the tip of the coccyx. 2 to 3 centimeters in, and then starts the anal canal. So now, talking about the relations of the rectum. And when it comes to any abdominal organ, the relations are described as peritoneal relations and visceral relations. So peritoneal relations of the rectum, very unique. In upper 1/3, middle 1/3, lower 1/3. Upper, middle and lower 1/3. Upper 1/3 there is peritoneum anteriorly and laterally. In middle 1/3 there is peritoneum only anteriorly. In lower 1/3 there is no peritoneum, not attached to peritoneum. Okay? समझा? Upper 1/3 there is peritoneum anteriorly and laterally. In middle 1/3 there is peritoneum anteriorly. Lower 1/3 peritoneum absent, not related to peritoneum. When it comes to visceral relations of the rectum, so the peritoneum goes like this. Visceral relations are written as anterior 2/3 and lower 1/3. Anterior 2/3 and lower 1/3. When it comes to anterior, writing at the anterior relations of the rectum. Okay? When you are writing the visceral relation, anteriorly in the two-third, upper two-third, there is a pouch and small intestine. Now pouch, I am just saying pouch because in case of females there will be recto-uterine pouch, in case of male there will be recto-vesical pouch, and there will be coils of jejunum and ileum. Now lower one-third again differs in case of males and females. In case of males, the lower one-third will be related to prostate, seminal vesicles, prostate, seminal vesicles. In case of females, it will be related to the lower part of cervix and vagina. Okay? And because it is related to prostate here, the prostate is palpated by per rectal examination. If finger is inserted in the rectum, if you want to check whether prostate is enlarged, one can feel the posterior surface of prostate. Because anterior relation of the rectum is prostate. So relations are clear. Now this, even relation with the vagina, that can lead to a recto-vaginal diverticulum also, or recto-vaginal fistula. Recto-vaginal fistula, which can be the most horrible thing a female can have, because rectum has all infective matter. Okay, and the stool is going to vaginal area, then it can cause vaginitis. Okay? Now here what happens is there are transverse folds. Transverse folds of Houston, which again prevent the sagging down of the stool. Rectum functionally has two areas, functionally, where upper half is for storage and lower half when it distends, it leads to reflex. Okay? When upper half distends, it can manage to store some amount of stool, not major portion, some portion. But when that stool enters the lower half, it distends the lower half of rectum, a person gets desire to defecate, use the toilet, lower half. Blood supply of the rectum is from superior rectal artery. What is superior rectal artery? It is continuation of inferior mesenteric and middle rectal artery and inferior rectal artery. Okay? The venous drainage is from superior rectal vein, which continues as inferior mesenteric vein, which joins splenic vein, which joins the portal vein, Okay? No. Risham अभी बुक ओपन है तुम्हारा? लिम्फेटिक ड्रेनेज क्या लिखा है? Most of the lymphatic drainage of rectum, especially areas like rectum, goes to internal iliac lymph nodes, but I'm just confirming. Or without apron? No. Apron actually नहीं मिल रहा. तू लेट आया था ना? तो एप्रन ढूंढ रहा था. अरे दोनों काम एक साथ हो गया था. क्या नाम है आपका? Yes. बैकअप का भी बैकअप होना चाहिए यशराज। हाँ नहीं 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 नहीं, this all these arteries, they will be coming from the internal iliac. Okay, ultimately from the internal iliac. Some are branches of internal iliac, some may be the branch of pudendal. Okay, हाँ internal iliac lymph nodes लिखा है, superficial inguinal, superficial inguinal. So lymphatic drainage, upper part to internal iliac, and I want you to tell me, and lower part into superficial inguinal. I want you to tell me the nerve supply also. Nerve supply देखो यहाँ पे ना parasympathetic, whether it is bladder, whether it is your uterus, whether it is rectum anal canal, parasympathetic is very easy for us. S1, S2, S3, S4, nervi eryngeitis, ये सब के लिए उसका पेन that is also very easy. S2, S3, S4, pudendal now. Only thing you have to remember about sympathetic, जो कि हमको कृषांग अभी बताएगा. T11 normally T11 to L1 ऐसा रहता है. L1, L2, okay. L1, L2, okay. L1, L2. I'm going to repeat all this, don't worry. Now writing the applied anatomy. Applied anatomy हमारे headings क्या है? एक है supports of rectum. Nisha, I am going to need your help for this. Supports of rectum. One is always perineal body. Okay? One is always the perineal body. Two is always the pelvic diaphragm. Pelvic diaphragm. Three, रेक्टम. आई एम टॉकिंग अबाउट रेक्टम. तूने ये सब बताया, एनल कनल को बताया, सेम है ना. सपोर्ट्स ऑफ रेक्टम में पेल्विक डायफ्राम, पेरिनियल बॉडी आर द मेन. एनीथिंग एल्स? Actually these are the two main supports. These are the two main supports, and some books they talk about this lateral ligament of rectum, just condensation of fascia, and the two fascia, one is going anteriorly, one is going posteriorly going to the sacrum, anteriorly going to the bladder and uterus. So they also form support, but main support is always perineal body and the pelvic diaphragm. फर्स्ट पॉइंट क्या था एप्लाइड एनाटॉमी में? हाँ, क्या बात है. एटलीस्ट लास्ट लेक्चर में आप लोग एकदम जोर से आवाज देके बता रहे. सो कंजेनिटल में देखो यहाँ पे इश्यू ऐसा कि हमने डिस्कस किया था ये क्लोएका है. फिर क्लोएका गेट्स डिवाइडेड बाय यूरोरेक्टल सेप्टम. जिधर भी सेप्टम है उधर प्रॉब्लम है. रेक्टो वसाइकल fistula in case of males. Case of females, rectovaginal fistula. Okay, fistula. Okay, so first is congenital. Two, investigation. PR and procto. Rectum, there are two investigations. There are two investigations. One is per rectal examination. where after putting gloves and lignocaine gel, finger is inserted slowly and you can feel. But many times you may want to see. So that time a proctoscope is inserted. A small proctoscope is this only this much inserted, and then with the torchlight they see the mucosa. The proctoscope is slowly withdrawn. So that is called as proctoscopy. Proctoscopy. 3. Medical problems. Medical problems is proctitis. Proctitis is inflammation of rectum. Proctitis is inflammation of rectum. 4. Surgical. Now one thing you need to know. Also in medical problem, or in surgical problem, you have to write about rectal prolapse. Rectal prolapse. Multiple reasons for that. Mucosa prolapsing. Okay. आणि 5वा point, rectal cancer. I'll talk about this rectal cancer towards the end. तुझं झालंय का सगळं घेऊन? आता मध्ये हातातच घेऊन कर, अनलेस तुला काही लिहायचं असेल. So we are talking about rectum. The meaning of the word rectum is straight in human beings. It is straight in lower animals, but human beings, because we are straight position, the rectum shows 3 curvatures side to side, 2 to the right, 1 to the left, and there are folds of Houston over there to prevent the sagging of the stool. And there are 2 anterior-posterior curvatures, one concave along the S3, S4, S5 vertebra where the rectum starts, and next is when it turns into anal canal, okay, and that is 2 to 3 centimeter below the tip of the coccyx. That's what the extent of the rectum is. When it comes to the relations of the rectum, firstly talking about the peritoneal relations. In the peritoneal relation, upper 1/3 it is related to cover the peritoneum anteriorly and laterally. In middle 1/3 only anteriorly, in lower 1/3 there is no peritoneum. Coming to the visceral relations of the rectum, they are divided into upper 2/3 and lower 1/3. Upper 2/3 is always related to a pouch. That pouch may be a rectovesical pouch in case of males where there are coils of intestine, or rectouterine pouch in case of females where there are intestines. Lower 1/3 again different in male and female. In males it is related to prostate, seminal vesicles, and maybe some part of the urethra also. In females it is related, the lower 1/3 is related to maybe the terminal part of the cervix, the vagina, and the urethra also. Therefore rectovaginal, all these fistulas can happen. Blood supply of the rectum is from superior rectal artery, which is continuation of inferior mesenteric, and also from middle and inferior rectal arteries. Venous drainage is into superior rectal vein, and which ultimately goes to the portal vein, and also by middle and inferior rectal veins. Now they go to the systemic. So again a site of portocaval anastomosis. Lymphatic drainage, lower part, upper part into internal iliac, lower part into superficial inguinal lymph nodes. So they can be enlarged there. The nerve supply is by S2, S3, S4, nerva laryngitis, parasympathetic, S2, S3, S4 pudendal nerve for pain, and L1 and L2 sympathetics. Supports of the rectum mainly perineal body, pelvic diaphragm, and lateral ligament of the rectum, and also the anterior and posterior there are fascia. Posterior fascia connects it to the sacrum. Functionally the rectum has upper half which kind of stores the stool, but when that stool sags into the lower half, it is distension which leads to the reflex. Applied anatomy, congenitally, because it develops from the cloaca and urorectal septum, there can be rectovesical fistula in male, rectovaginal fistula in females. Investigations per rectal examination and proctoscopy. Medical problems, proctitis. Surgically, we talk about the rectal prolapse. And last point is rectal cancer, okay, which is very, very common in those having non-vegetarian food, red meat especially. So we are discussing about rectal cancer, and here rectum is kind of ending and anal canal is starting. Okay, so this is the recto-anal angle. Anteriorly here is pubis. From this pubis, okay, there is a puborectalis muscle. This muscle has to be taken care during surgery. If it is cut, then this angulation is gone. Rectum just become like this, and the stool starts sagging again and again. This angle, when it is pulled up, the rectum anal canal angle becomes like this, and therefore the stool does not sag down into the lower portion of the rectum, and that kind of does not cause frequency of passing stool. It doesn't increase. Now this muscle, very important, this muscle relaxes while passing stool, right? When passing stool it will relax, the rectum becomes almost like a continuation with the anal canal. But this relaxes only and only in squatting position. It doesn't happen on a Western toilet. Okay? So that means in a Western toilet, a person is passing stool without this getting relaxed. Again and again there can be friction. So now, what is the solution for this? Now you may say that in my house there is already Western toilet. Now I cannot change to Indian toilet. There are grandparents. So put a stool below the legs. Small stool, so that the legs becomes like this. So it becomes kind of a squatting position. This muscle relaxes, and the the inflammation of the rectum can be prevented by this. So always put a stool of this much height when you sit on a Western toilet, so that puborectalis muscle can relax. And tell this to others also, the lay persons. Thank you. So the best diet for any living being is the food that person can eat without cooking. That is the best food for that living entity. Like for a lion, for a tiger, deer is the best food. So what are the things which you and me can eat without cooking? Fruits, salads. And you go to any doctor after having diabetes, hypertension, this problem, that problem, gut problem, acidity, he will only say increase fruits, increase fiber. Constipation, piles, fissure, fistula. So more the proportion of the things which you can eat without cooking, the best is our health. Okay? और जितना masala, all those things which you require to put more and more masala to digest. That is actually good for the tongue. वो स्मेल भी आता है तो ऐसा हो जाता है. In short, the principle is what tastes good is not good for our health. What does not taste good is good for our health. Example, karela, shepu, methi. This I suppose relish से नहीं खाओ. घर पे जब करेला, oh wow, नहीं. Karela, Loki, Bopla, all those things. So those things which may not taste so great, but they are great for our health. Okay, therefore so that's the principle. हम लोग को हमारे इंडिया में कुंभ मेला वगैरह जमता है ना, तो लोग ऐसे आते हैं हिमालय से वगैरह, तो उधर क्या बनता है? उधर आग ही नहीं जलता है, तो क्या उधर रूट्स एंड फ्रूट्स पे जीते हैं लोग। हाँ, हम लोग के लिए वो थॉट भी है। मैं अगर कल से बोलूँ कि शिफ्ट टू फ्रूट्स एंड फ्रूट्स, इट्स वेरी डिफिकल्ट फॉर अस, बट व्हाट आई एम टेलिंग इज whenever possible, increase the content of fibrous food. Okay, and that brings to us to this topic, where fiber matters, and we are discussing about the anal canal. Anal canal, the length is 38 millimeters only. माझ्या नंतर कोणाचं लेक्चर आहे? डिसेक्शन आहे डायरेक्टली. हां, सुमित सर. ओके, कुठे होतो आपण? 38 millimeters. It starts 2 to 3 centimeters below the tip of the coccyx and ends 4 centimeters below the tip of coccyx. So it's running slightly like this. Okay. Length is 3.8 centimeter. 3.8 centimeter. Okay. बट ये 3.8 सेंटीमीटर पे हमारे सर्जन्स के घर चलते हैं, बिकॉज ऑफ आवर bad eating habits. Because of our bad eating habits. And the worst thing is refined flour. Refined flour. मैदा is zero fiber. Zero fiber. सत्य वचन. कुछ भी उसमें फाइबर का कंटेंट नहीं होता, और फिर वो टेस्ट में इतना अच्छा लगता है. बर्बन बिस्किट, बॉन क्या बोलते हैं उसका एक्चुअल में? बर्बन. देन ऑल दिस बिस्किट्स, कुकीज, बटर कुकीज, ये सब मैदे का रहता. वो व्हीट के साथ बना के देते तो हम, फिर माँ आपकी एक दिन लेके आती कुछ तो बिग बाजार से कहीं से, तो व्हीट वाला कुकीज, फिर आप पहला बाइट लेते, मिठा जैसा टेस्ट. ऐसा क्यों? बट दैट इज गुड. This anal canal, now I am drawing. I have already told you that this is the rectum, this is the recto and anal angle, and somewhere here down the anal canal starts. Okay, the anal canal starts. Now how does the anal canal look like when in a coronal section? In a coronal section, the anal canal looks something like this. Okay, this 38 millimeters, श्रेया कुठे? श्रेया, डॉक्टर श्रेया. आणि तो मुलगा तिथं त्या मागच्या बेंचवर बसतो तो, संस्कार गिरी. हाँ, नहीं है ना? शफवान, रत्नदीप, तो प्रदीप ना तुझं ना? प्रशांत.